Good evening, and thank you for joining us this evening for our virtual community town hall addressing COVID-19 in the Fredericksburg region. Throughout the pandemic, Mary Washington Healthcare leadership has been committed to keeping our community informed, and we know that COVID-19 continues to raise many questions. So tonight, we are here to share what we know about the COVID-19 in our region and what we can do all together to keep safe and healthy. During this town hall, you will hear from our expert panelists, and we welcome you to ask questions in the chat during the conversation. So let's meet our panelists. Tonight, our first panelist is Dr. Mike McDermott, our President and Chief Executive Officer. Second, we have Eileen Doman, our Chief Nursing Officer. And our third panelist is Dr. Christopher Newman, our Chief Medical Officer and Chief Operating Officer. So Dr. McDermott, would you mind starting us out and letting us know what's happening here in the Fredericksburg region?
Thank you, Lisa, and thanks everybody for taking a little bit of time out of your evening to tune into our Facebook town hall. You know, we've been doing these town halls really throughout the COVID pandemic to be transparent with our community about what we're seeing here in the Fredericksburg region and at Mary Washington Healthcare. And to be honest with you, you know, at the end of June, I was hopeful we wouldn't have to do these anymore, right? There was a period at the end of June where we didn't have any hospitalized patients at Mary Washington Hospital or at Stafford Hospital who required hospitalization to help them battle COVID-19. But since the beginning of July, that we've seen a trend going in the wrong direction. So currently we have 27 patients hospitalized between Mary Washington Hospital and Stafford Hospital that require hospitalization to help them battle COVID-19. I want to walk a little bit through the graph. You know, this graph goes all the way back to the early days of the pandemic, back in March of 2020 on the left-hand side. And then you move along the timeline to the right-hand side to today. And the yellow line, that's the number of patients, the patient count on the over to the left will give you the numbers. The patients we've had hospitalized every single day through this pandemic. The orange line superimposed on top of that, that's over on the scale to the right. That's the number of hospitalized patients in the state of Virginia. And you can see our experience at Mary Washington Healthcare in our hospitals has very, very closely mimicked the incidence of hospitalized patients in the state. We saw the early peaks in the spring of 2020 and then in the summer of 2020, but nothing like the peak that we saw at the beginning of this year in January of 2021, when we had over 100 hospitalized patients here at Mary Washington Healthcare, and there were over 2,500 hospitalized patients in the Commonwealth of Virginia. Vaccinations came, and we were able to break the chain of transmission, and we were able to see a significant downtrend in those hospitalizations. And then you work your way along that graph into the end of June, where we had that period of time where we had no hospitalized inpatients at Mary Washington Hospital or Stafford Hospital that needed inpatient treatment for COVID-19. Things have changed a little bit, and there is a new variant that is more transmissible and a little more virulent. People are getting sicker quicker with this new Delta variant, and it has very, very rapidly in the United States of America over the course of the last month become the dominant strain of COVID-19 that is out there. I believe it's over 95% of COVID infections currently in the United States are caused by this Delta strain of the virus. So very, very transmissible. The early alpha strains weren't nearly as transmissible. These new strains are some of the most transmissible human viruses, this Delta strain, human viruses that we've seen. It mimics the chickenpox, varicella, and other viruses that are very, very transmissible from person to person. So that has led to a little bit of the uptick that we've seen. And so we wanted to get back and share with our community that we are seeing an increase in hospitalizations here at Mary Washington Healthcare. We are seeing an increased positivity rate of test positivity in our Fredericksburg region. And I'm encouraging everybody to do everything that they can to protect themselves. And the most important thing that everybody can do is to become vaccinated. These vaccines that we have that are authorized for use are very, very safe and very, very effective and protective, even against the Delta variant. Nothing is 100% certain, but the best health decision that you can make for yourself, your family, and your loved ones is to get vaccinated with one of the COVID-19 vaccines as quickly as possible if you have not taken the opportunity to do that.
Thank you, Dr. McDermott. And some of the other things we're hearing about in the news is kind of the rollback to masking and social distancing. How is that helpful? People are arguing, well, if I'm vaccinated, do I need to be masked?
Yeah.
What are your
So
recommendations?
there's a lot of people, I hear people talking about, oh, people are changing recommendations. First, they told us we didn't have to wear the mask. Now they're saying wear the masks again. And I use an analogy for that. It's like an umbrella in the rain, right? And you could talk about COVID prevalence like rain, right? When it's raining out, you might use an umbrella to protect yourself. And so when there's high COVID prevalence, you will wear a mask to help protect yourself. When it stops raining, you might take your umbrella down. You don't need it. It's the rain isn't around. Well, the same thing with COVID prevalence. When there's not a lot of COVID around, you might be able to recognize that and take your masks off. That's the period of time we saw at the end of June. But very, very rapidly, we have seen an increased prevalence again. It is raining again. So it's time to put the umbrellas back up to protect ourselves. It's time to wear our masks again to help protect ourselves and lower the spread of the coronavirus. And so it's logical, right? It's a response to the current conditions that masking requirements might change. And nobody should be surprised by that. It's just simply a recognition of the current conditions. And currently, there is high prevalence of the coronavirus with a strain that is very highly transmissible and creates higher viral counts in individuals that are infected. And so it's very, very prudent, especially in indoor environments again, to wear a mask at this point in time.
Thank you for that explanation. And Eileen, as a result of the numbers climbing that Dr. McDermott just shared with us, we've had to make some changes here at Mary Washington to anticipate these numbers. Can you talk a little about what's been going on at our hospitals?
Sure. I think what the numbers have told us is we need to be prepared. You saw in the graph that Dr. McDermott showed, we've had multiple, peaks, some not that high, some super high. We hope we never see what we saw back in January, but we need to be prepared. And so we're preparing for that increase in census, going through all of our PPE to make sure we have adequate PPE supply, paying attention to our staffing. I see there's even a question about, do we have adequate staffing? We have staff to take care of the patients that we're caring for today. But why do we need to get to a place of having 100 COVID patients again if we can do something to prevent that by being vaccinated? I don't want our staff being placed at that risk. They've worked too hard for the last year and a half. And so the best thing to do to take care of our staff is to make sure that everybody is vaccinated. But we are making changes. We made a change this week with our visitation and cutting back a bit on visitation access. So in our emergency departments, we can have up to 2 visitors 24/7 with a patient in the emergency department. For all the other areas of the hospital, sort of think about it's the rule of 2 and it's 10 a.m. to 10 p.m. So from 10 a.m. to 10 p.m., we are allowing visitation and we are allowing 2 people to visit, but they need to be the same 2 people during the whole hospital stay. And we know that's really difficult. We want loved ones to be with our patients when they're in the hospital, but we need to be very mindful of who's in our buildings and how our biggest responsibility is to protect our staff so they can be here to take care of our patients so we can protect our patients. And so we've cut back a bit on visitation this week, and I know that's difficult, but it's all from the context of safety, keeping our associates safe and keeping our patients safe. And we'll continue to look at everything else that we do. We may have to take other measures, things like limiting in-person meetings or anything else that we need to do that really keeps us always focused on how do we keep our staff safe and how do we keep our patients safe.
Thank you, Eileen, for that explanation. Dr. Newman, can we talk a little about vaccines? Eileen actually alluded to it a little bit, and those that are watching might have seen on the news that we did require it for our Mary Washington Healthcare Associates and some others. Can you talk to us a little bit about that?
Yeah, as a healthcare organization, we have a sacred duty to protect the patients who come to us for care and protect the health of our community. That's unequivocal. And there's nothing that we can do to protect them during this pandemic more than vaccination. So we've unanimously decided to move forward with requiring vaccination for all of our associates here at Mary Washington. We're also going to be requiring that of the medical staff, vendors who spend time in our facilities, students and volunteers and others. So this is a requirement that we are moving forward with. The data supports the vaccines, again, unequivocally. These are very safe and effective. vaccines. And there have been numerous cases, across the country, and even some cases here in the Commonwealth of a staff member passing COVID to a patient. That's unacceptable if we can prevent that with vaccination. We have patients who come to us with all sorts of serious medical problems, immunocompromised, cancer treatments, children who have not been able to be vaccinated yet, neonates, and it is our responsibility to not put them at risk. So this is not a political decision. This is the right thing to do.
Thank you. And you mentioned children coming in under our care. We've seen a rise in the data showing younger folks, including children, are contracting the virus a little more than they were the last time we had this conversation with our viewers. Can you talk a little bit about what's happening with the younger population right now?
Yeah, this is something concerning that we're keeping a very close eye on with this Delta strain. Since the very beginning, children have not been completely immune to severe conditions from COVID or severe reactions to COVID. And we've had, several here in our health system have had to transfer others out to some of the pediatric hospitals here in the state in Washington, D.C. But what I'm watching in Florida right now, where the pandemic is really pretty significant in other areas, children's hospitals are filling up, and they're at the record rates of admissions of children for COVID. So this is something we're keeping a very close eye on as particularly as we move into the school years.
And we actually, one of our pediatricians, Dr. Irwin, recently did a video about how to prepare your children and what you can do to keep them safe. We'd like to show that video now for those who are watching, and then we'll move into our Q&A.
What can parents do to help keep kids safe from COVID-19, particularly as they go back to school? Great question, and I know this is on everyone's mind as COVID numbers are increasing substantially among kids. To give some context, nearly 72,000 children and teens caught COVID-19 nationwide during the last week of July, mostly the new highly contagious Delta strain. This is about 5 times as many kids who were sick at the end of June. So regarding the Delta variant as it relates to kids, here's what we know and don't know so far. We know that this strain is far more transmissible or contagious than previous strains. What we don't know is if it is more likely to cause severe illness in kids. But due to how contagious it is and the fact that children, at least young children, aren't able to be protected themselves with vaccination yet, we know that we are now seeing a significant surge in inpatient pediatric floors and intensive care units all across the South, including Virginia, where there are kids as young as a few months old who are sick. So while severe COVID-related illness in children has been uncommon prior to the Delta variant, it's critical that we recognize that this Delta strain is very capable of causing severe illness in even healthy kids. Combining the fact that the Delta variant is so contagious and that some of our children's hospitals are filling up and we haven't even started school, all of this together has the pediatric community concerned at this time. We see the recent spike in pediatric cases and hospitalizations as a flashing yellow warning sign that we should double down on the following effective, safe, proven methods to help protect our children. As a pediatric community, we know we still want the kids back in school at this time, but it is imperative that we do so safely. So, what can we do? The number one thing we as parents need to think about is the vaccine. I would strongly urge parents, caregivers, family members, adolescents 12 and over, and teachers all to get vaccinated. Doing this helps create a protective cocoon around our kids who aren't yet able to be vaccinated and are an increasingly vulnerable population. Additionally, we might want to talk to anyone interacting with our kids about their vaccination status. If the person isn't vaccinated and the parent still feels okay about having them around their unvaccinated child, at least kindly ask them to wear a mask or even consider asking them to get a test prior. As one of my pediatric colleagues, Dr. Maldonado, a pediatric infectious disease doctor at Stanford, said, "You wouldn't want your child in a car where someone was driving without seatbelts or without a driver's license, so we shouldn't be afraid to stand up for our children's health." In terms of reducing spread, we as parents should teach our kids good hand hygiene, to cough into our elbows, and to try to keep some physical distance. We can also think about maximizing time spent outdoors and wearing masks when indoors. Regarding masks, the American Academy of Pediatrics, AAP, recommends everyone older than age 2 wear a mask when returning to school, regardless of vaccination status. The data strongly supports that masking is a very effective way to prevent infection. Go ahead and get them a mask with their favorite superhero on. How do we talk to kids about the virus? Kids are perceptive and smart, and even 2-year-olds can pick up on changes in their environment and emotional cues. With younger ones, we might tell them that the virus kind of grew up and has gotten a little bit stronger, so we have to fight a little bit harder. With older ones, I would be direct and state the facts and let them know that we are doing what we can to help them and keep them safe. Also, we can try to keep the dialogue open and encourage our kids to be open with us, especially if they are not feeling well, so that we as parents can keep them home and remind our kids that staying home isn't a punishment, it is to keep people safe. There's a lot of information circulating, and unfortunately not all of it is accurate. Your child's pediatrician is the best source for information. They know your child's medical history and can answer your specific questions based on this information and the latest COVID data in the community. Thank you.
Well, we appreciate Dr. Irwin's point of view, and I think that'll help answer some of the questions that might be coming to us in the chat. I'd like to turn it over. We've been getting a lot of really great questions in our chat already. The first one that came in was asking about the required vaccinations. Does this apply to the EMS crews that bring patients to the emergency department or to and from the hospital system?
Any badged vendors or any vendors who spend any significant amount of time in our facilities will be required to be vaccinated, and we're working with the employers of those that we engage with regularly. There may be individuals who come here just very occasionally, and those we'll treat as visitors. We won't be monitoring the vaccination status in every individual who enters our facility. But for those that we partner with regularly, we will be working with employers to ensure that vendors are providing a safe environment here in our health system.
I would say the same principles, though, of patient safety, public health, and public safety really apply to emergency medical personnel, though, that might be responding to individuals in our community. And I certainly hope that every single EMS provider in our community would be vaccinated to make sure that they are creating the safest environment for the patients that they are coming to care for.
Thank you. What is the experience locally with fully vaccinated patients being infected with COVID? What are we seeing in our testing?
Yeah, so we are seeing what is being termed these breakthrough cases. So that is occurring in our community just like it is across the country. And as you can see here in the Commonwealth, of the 228,000 cases occurred in not fully vaccinated, and just 3,000 or 0.072% of the cases being breakthrough cases. Again, 97% of people sick enough to be hospitalized were unvaccinated, with 0.0047% being these breakthrough cases of fully vaccinated. And again, the same thing with deaths. 98% of deaths were not vaccinated, whereas 0.0011% or 50 individuals in the Commonwealth. So the risk is not zero. And as Mike spoke, we're masking. Now, if there's a storm, it's raining out, and we're recommending increased protection, including for the vaccinated at this point. But there is no question that the vaccine gives much greater protection than the unvaccinated. And Delta is just ripping through unvaccinated individuals and communities at a very alarming rate. Here at our health system, we have had a handful of patients who have been hospitalized with Delta and breakthrough cases, but none of them to date have been sick enough to require ICU care, and they're generally not as sick as our unvaccinated patients.
Thank you. And we are already getting some questions about booster shots, about specific ones like the J&J or others. What do we know about boosters? Do we think this is going to happen? And if we do, how soon?
Most of the data that I'm seeing at this point is leaning that there will be likely a recommendation in the near future surrounding boosters. That it right now is most likely to be first for those who are immunocompromised, who may not have got a robust enough response from the 2-dose regimen or a 1-dose Johnson & Johnson vaccine. And my understanding is the FDA is beginning to look at that data and deliberate on that. I've heard other experts think that they're anticipating that further booster recommendations may occur later in the fall for other individuals, and it may be those over a certain age or those who completed their initial vaccine course, greater than so many months ago. But the data is still, not completely compiled. I do know that other nations are starting to move forward with vaccination as they've seen some waning of the vaccine over time of the efficacy. So it is likely, but there have been no formal recommendations to date.
And we're getting some questions about rumors of the vaccine's efficacy. Is there any truth to the rumor that the vaccine has caused infertility in women?
That is complete misinformation. That is not founded in any reality whatsoever. There's many of these myths and misconceptions and misinformations that are being placed out there by those that are quote anti-vaccine, and those get perpetuated and amplified with social media and other outlets. And it's very unfortunate. It is absolute misinformation. There's no truth to that whatsoever.
And you had mentioned that the vaccine does potentially become less effective over time. Should people be worried right now about the efficacy of their vaccine if they got it already earlier this year?
Well, the positivity rate in our region is over 10% right now. So it is where we were at the height of the pandemic in the winter. So I think there is some concern even for the vaccinated, and there needs to be some prudence and care to protect yourself at this time when things are really raging and when the virus is really prevalent in our community with Delta. We don't really know how much the vaccines wane in their immunity over time at this point, and that's something that's being looked at very closely right now. And hopefully within the next few weeks to months we'll have some information. But quite honestly, once these boosters are out, this Delta variant will, have already run its course. So it's unlikely there's going to be any recommendations or implementation of boosters prior to Delta having, run through this peak, which we're living through right now. But in the future, we'll be getting more information on that.
I'd like to pivot a little bit to our visitation policy and our vaccination requirements that we mentioned earlier. The first question we had about visitation was about minor. If my minor child is admitted to the hospital for COVID, can I visit with them if I am vaccinated? Eileen, can you talk a little bit about visitation when it comes to pediatric patients?
Sure. When it comes to our patients, we know that parents need to be with their children. We want that parent or guardian. So we'll allow 2 parents or guardians access 24/7 when their child is in the hospital. And so there may be some limitations in our NICU or in our intermediate level nursery and limiting that to 1 parent or guardian. But no, if your child is here with us with COVID, we know that you need to be with them. And that is part of our visitation coverage at this point.
Thank you. And I'd like to talk a little bit about how our requirement is going for vaccination among our staff. How many of our staff are already vaccinated?
Well, over 95% of our medical staff, our physicians and medical staff are vaccinated. And we're approaching 80% of our staff at this point have been otherwise vaccinated.
And is there any concern about associates declining the vaccine and causing any kind of a staffing issue?
Yeah, we're putting plans in place right now for that very thing, is that, there'll be very limited circumstances. There could be people that are exempted from the vaccine, and we'll put a process in place for that. But all of that planning is well underway, so we can make sure that we can be here to take care of our community if people were to make that choice.
And Dr. McDermott, you've talked some in our associate town halls. We've talked to our associates quite a lot and informed them a lot of things going on. And you've talked a lot about other organizations nearby who have already gone through mandates for vaccinations. Can you talk a little bit about our expectations of success?
I think we see that in the news every single day. There's more and more organizations, not just healthcare organizations, but many other industries that are requiring vaccination. The U.S. military, I think, just announced that they're going to be requiring it for all service members. It's really there's been a lot of politicization about this COVID vaccine for some reason, but really a vaccination against an infectious disease like COVID is really a routine public health requirement for us to live in a civilized society with one another. It shouldn't be politicized in the way that it is. We do a lot of things for public health and for public safety when we live in a civilization with one another. I mean, there are things like smoking, right? You can't smoke on an airplane, right? We don't allow that because you might make somebody who's around you ill, right? Driving on the right side of the road. You don't get to make a decision whether you're going to drive on the right side of the road or the left side of the road today because you're choosing your individual right. We all drive on the right side of the road for public safety reasons. And so there's so many things in our society that we do for one another so that we can live with one another in our civilization. And so immunization against infectious diseases that can harm others and cause death and morbidity is a routine requirement for that. And so we're moving forward with the vaccine requirement. We also have a sacred duty to our patients and to all of us, one another as caregivers, to keep one another safe. Many hospitals and health systems have done this. The first one to do it, really the trailblazer, was Houston Methodist in Houston, and over 20,000 employees and associates there. And they had less than 200 associates who didn't get vaccinated with the COVID vaccines. And so a very, very successful response by their associates to rise to the occasion and create the safest environment that they could for their patients and for one another in their healthcare system.
Thank you. And will we require the vaccine for students who come into our facilities?
All students who come into our facility will be required to be vaccinated.
Is there a possibility that anyone who is able to get an exemption, we are offering limited medical and religious exemptions. If they qualify for an exemption, would they have to be tested regularly as a result of that?
We're going to be providing exemptions as required by law, the limited religious and medical exemptions as required by law. And we are looking at testing and other means to ensure that our associates are safe and COVID-free as they're providing patient care.
We're getting a question here about vaccine safety. Of the vaccine being touted as the only solution to the pandemic, they're asking if there are natural remedies that could treat this virus.
Not really. I mean, the vaccine is the treatment. I think earlier in the pandemic when this came out, I said we received a shipment of hope. At this point, the vaccine is the way out of this pandemic. There are no really efficacious treatments for COVID at this point. Natural immunity appears to wane and not work for some of these newer strains of COVID, so that doesn't protect you. So the vaccine is really the best thing that we have at this point to protect us. And in any pandemic, a vaccine is really the way to treat this and prevent things from continuing to worsen and progress.
And we are getting questions about adverse reactions and deaths listed on the publicly reported VAERS system. Can you talk a little bit about what that is and how it works?
Any self-reported reaction or death, anytime related to the vaccine, are being reported, and that's a safety parameter. That does not mean the vaccine caused that death. If I got vaccinated and a month later was hit by a car, that could be reported to the VAERS system. And our public health officials and the CDC, they review all that and they look for trends that would be more related causally to the vaccine. And there have been a few of those very, very rare situations thus far, such as the blood clot situation that we spoke about with the Johnson & Johnson vaccine, a myocarditis involved with young men and the mRNA vaccines. But the actual side effects from the vaccines, the actual adverse reactions are very rare and very limited, and they're not thousands and thousands of deaths caused by the vaccine.
We're getting some questions to pivot a little bit, is hearing about children's hospitals being filled. We hear these stories on the news in other parts of the country, and people are nervous about their kids starting back to school. I know we've covered it a little earlier in our session, but for those maybe who have joined late, how does this Delta variant compare to COVID-19's original strain from a year ago when it pertains to children or young adults?
Yeah, I want to quote Dr. Scott Gottlieb, who is the FDA previous FDA administrator, and he said we need to approach this school year with humility and prudence, and I think that's the right way to approach this. There's many who are anti-mask of children in school, and I think that's a simple thing that we can do to protect our children as Delta is going through our communities. There is a lot of risk and there have been a lot of ill effects to children, not from the virus, but from a lot of the restrictions that have been placed in our environment. As an adult, we're in a different developmental stage of life, and we're able to deal with some of these things a little different than a 5-year-old or a 7-year-old who's lost a year and a half of school and socialization, some of those normal things. So there are risks by not trying to normalize life for children. So I don't want to minimize that. As a parent of 4 kids myself, I'm seeing those kind of things, and I think children should go back to school at this point, but we should be masking and we should be prudent as we approach this with the Delta variant. What we do know about the Delta variant is it's much more transmissible, up to 5 times more contagious per se than the initial strains of COVID. So that is concerning in children. And we are seeing increased hospitalizations in places where this is preceding us a little bit, like Florida in the children's hospital. So it's something we're going to have to watch very, very closely. But I will say there is a risk for children not being at school. There is a risk for children not having some of those kind of socializations. And particularly, this is in a few months. This has been going on over a year and a half. So when we look at the developmental life of a child, that's a long time. So with everything, there's no perfect answer. There's risks and benefits. And I'm very confident in our school administrators and public health officials that have been taking this very seriously. And I've had the ability to weigh in and talk to some of them as they've made these difficult decisions.
And do you think there's a chance that kids under 12 will get an opportunity to have a vaccination?
They are studying that and looking at it at this point. So there is likelihood. I can't predict, but that is being studied and looked at this time.
I appreciate everybody this evening for helping us out. We actually have reached the end of our questions for this evening, right at the half-hour mark. So we're going to go ahead and wrap up. We did say maybe June was going to be our last one of these, and maybe this will be our last one if everybody does their part and stays safe and wears their mask and gets vaccinated. So thank you to all of our panelists this evening for joining me, and thank you to all of you for tuning in and watching our community town hall. If you are looking to get a vaccination and haven't gotten yours yet, you can go to vaccines.gov and search for a location close to you. And you can also search by the type of vaccine you might be interested in receiving. If you are having any symptoms and you're not sure where to seek care, you can also call our Mary Washington Healthcare Nurse Advice Line. They are open daily from 6 a.m. to midnight, and you can contact them by dialing 741-1000 to speak to one of our great nurses. If you missed some of tonight's town hall, you can still watch the recording on our Facebook page later today, or on the Mary Washington Healthcare YouTube channel. Be sure to share the recording with your friends and family and colleagues so they too can be informed of how the pandemic is affecting our community. Thank you. Please stay safe and healthy, and have a good night.